many people, right, are actually able to, over time, develop good relationships with their therapists, so that if you ask them, right, if you do a psychotherapy alliance research, yes, I think my therapist cares about me and is warm and supportive and so on and so forth.
Mm-hmm.
Or, many people who actually sort of end up having these sort of implicit moments that we're talking about, but whose internal working models remain, or their ideas about themselves and how they relate, remain based on the old stuff. So even though we had a nice moment, then by the time you walk out of the office, you sort of zip up both the jacket and emotionally, and you still think I'm a lone wolf, and people don't touch me, or nobody wants to have anything to do with me, or whatever. So that in a way, when it stays implicit, in some ways, it works. It becomes the motor of the therapy. It allows things to happen. But there's another way in which this very attachment trauma or relationship trauma that we started by talking about the internal working model doesn't change. How one sort of sees oneself relative to other people doesn't really change. So that's why I take very small bits, right? Because if you take big bits, then the whole thing sort of short circuits. But take little bits, like a little smile, like a high five, like that takes a lot of courage, or whatever. And start to help the person have an experience of what it actually feels like to be connected, of what it actually, number one, that they are. That's the explicit part. And number two, like, okay, so what does that feel like? And sometimes it feels good, and sometimes it feels bad, and if it feels good, fantastic, then we get more resources. And if it feels bad, that's useful too, because the old stuff, like for the woman I described, is getting kicked up.